This conference will now be recorded.
Welcome in, everybody. Today we are going to be talking about splinting. So this session is going to be the introduction to your equipment review. Now remember, with splinting, what we're doing is we're minimizing the injury associated with the fracture or musculoskeletal system that's affected. So with splinting, first and foremost, we always want to check CMS. So we're going to check CMS before application of that splint and then after application of that splint to ensure that we're not compromising the circulation after we actually apply that splint. Other basic splinting rules is we always try and want to splint the joint that's above and below. So if this individual has an elbow injury or an arm injury, we're always going to splint below the elbow and splint above the elbow to ensure consistency and integrity of that individual's musculoskeletal system. Now, different types of splints are going to be associated with different types of injuries and different types of the body parts. So first, we're going to talk about some prefabricated splints. This is an example of a prefabricated pelvic splint. So this splint is going to be wrapped around the pelvic area in the event that we have a substantial hip injury. So it's going to be situated like that, so the pelvic area can be properly stabilized in the event of moving that patient and transporting that patient. Not very commonly seen as far as prefabricated pelvic splints because sheets and blankets work extremely well, which I will discuss once we get to that section. Other types of prefabricated splints. Most organizations out there are going to carry these because these are extremely nice. You already have your splint made. They're specifically designed for the body part that you're going to be treating. And this is an example of a couple of rigid splints. So here we have a long arm splint. And this is simply going to go through that splint just like this. And then we're going to go ahead and secure it around the muscle tissue, keep that arm straight. Other ones within your prefabricated splint, we have a hand and a wrist splint. We have a lower leg splint. We have a foot and ankle splint. And then we actually have a sling and swath splint as well, where this will capture around the patient's neck and ensure the integrity of the shoulder in the event that we have a substantial injury associated with that. So again, prefabricated splints are extremely nice. It's not one size fits all because you're going to have patients who are too big and or too small that won't actually fit that splint. Again, application, checking CMS. What we're trying to ensure with splinting is that individual is not injuring themselves anymore. Because we can't actually fix the issue, but we can minimize the effects of that issue. Other types of splints, not very commonly used anymore, but some organizations do carry these, and I think they're very nice, and this is the air splint set. So the air splint set, a variety of different splints. You open this up. So this is used for a leg injury set. So you can see that we got the foot end, and this is going to be wrapped around that patient's leg. And then you notice that there's actually a little air port here. So air splints are going to come with a hose. So you're going to go ahead and attach this to your patient after checking CMS. And then you're going to go ahead and attach the pump. And then you're very simply just going to start pumping it up. And then that air within that splint is going to start formulating around the patient. So the nice thing and difference between prefabricated splints and your air splints is that it specifically manipulates around that specific patient's body part. So again, very nice, not very commonly used anymore, but ensure that you are checking CMS prior to and after application of any air splint. Other types of air splints, we have specific to ankle and lower leg injuries. So it's a little bit smaller than that entire leg splint. We have whole arm splints. We have foot injury splints. And then we have wrist, ankle, and lower leg splint. Similar to the air splint is the vacuum splint. So a little bit different properties where we're actually inflating air in order to create that splint with the air splint. But with vacuum splints, this has got beads and air inside the system. So I'm going to go ahead and attach this around my patient. Let's say it's a lower leg injury, so I'm going to go ahead and wrap this around that patient's ankle. We have an air port here, and we actually draw air out of the splint. And so with the air being released, now the beads within the splint are actually going to form around that injured site and keep it nice and secure. So the vacuum splints are actually much more common and more popular than the air splints right now. For upper arm injuries, these are triangular bandages. So this is what you're going to utilize in order to create a sling in the swath. So these are triangular bandages. You pop them out. Unfold it, and then we can see how it's going to be utilized. So there we have the sling in the swath, the triangular bandage. So you notice that we got two long ends and we got a short end. So this is predominantly going to be utilized in order to secure the patient's arm in the event that we have any injury to the arm associated with it. Because this way we can go ahead and secure that arm. We can utilize different splints associated with it as well, and then keep that arm, excuse me, nice and secure. What you do is you tie a knot in the short end. And then you can go ahead and use that as your securing device within the elbow and then attach that. And I will demonstrate that within the sling and swath aspect. SAM splints. So this is a classification of moldable splints. Very commonly used. You will see this on basically any EMS service that you may become a part of. So the SAM splint, you roll it out. And this is the amount of surface that you have to work with. So these are great for forearm injuries, wrist injuries, ankle injuries, because you can mold it around the patient's ankle. You can go ahead and utilize it for a securing device for that patient's forearm. So you can splint it around there. And then go ahead and create your sling and swath and secure it with an ACE bandage. A lot of different varieties for it. Nice thing with the SAM splint too is it actually shows pictures of different applications and how you can utilize the SAM splint. Again, very similar to our prefabricated splints, the moldable splint will not fit all. So you're most likely going to have some void spaces in there. So if you attach this to the ankle, you're going to notice that there's going to be some void spaces. Great opportunity to use some of your rolled up cling to get in there, create a barrier device with those void spaces, and then splint that application. Next, these two different types of splints are very specific to a closed femur fracture. So a closed femur fracture, and it's got to be isolated as well. And this is what's called a traction device. So the traction device splints are utilized in order to pull the femur back into its normal position. When somebody has a fracture right here, That bone, what it does is it goes like this. So now the bones are on top of each other. And when we're doing our assessment, somebody's complaining of pain, I expose that injury site, I see a ball or a large contusion and swelling around that thigh area. And then I may notice too that that patient's leg is shorter than the other leg. So those are all indications that most likely it is a femur fracture. Keep in mind, femur fractures, utilization of that traction splint, you got to make sure that it's closed, because if it's open, we're going to go ahead and splint it in place, not utilizing traction splints. And then also it's got to be isolated. So there can't be any injury to the hip, there can't be any injury to the ankle. So the first one I'm going to show you is the Sager traction splint. The Sager traction splint is the most common traction splint that's out there right now. It goes in between the patient's legs. And it utilizes a traction device to pull in order to get that bone back into its normal position. So this gets situated in the groin. You got a hip strap that's going to go ahead and be wrapped around the patient's hip. You got your ankle strap that's going to be wrapped around the patient's ankle. And then once you get those two secure, you're going to start pulling traction until you get 10% of the body weight on that wheel and or 15. Once that's applied and done, then you can go ahead and secure it with the other 3 straps. Lastly, the hair traction splint. Not very commonly used anymore because they're extremely large, and then also the amount of area tends to compromise you actually setting the ambulance doors. So you're going to situate this underneath the patient's leg, undo your Velcro straps. This is going to be right underneath the patient's butt cheek. You're going to go ahead and secure that around the hip. You're going to secure your ankle strap during this time too with both the Sager and the hair. Make sure that somebody is either stabilizing that injury site and or pulling manual traction. Secure your ankle strap, and then this is going to be hooked in. And then you start applying traction until that patient feels relief. And again, make sure that we're checking CMS before and afterwards. The last splint that we're going to touch on is the full body splint. So remember, your C-collar and your backboard will actually provide splinting application for your patient as well. So let's say that you have a multi-system trauma patient and your patient is deteriorating. They're going into decompensated shock, where I don't need to take the time or want to take the time to, let's say, splint that injury, or excuse me, splint that pelvis injury. Instead, I'm just going to go ahead and utilize the backboard for that, because we can see with that hip strap, let's go ahead and secure in that pelvis area. All right, so the next several sessions of videos are going to be showing you individually each splint application, or indications or contraindications, what to be looking for. So thanks, everybody.